Hello, my name is Amanda Hanson. I'm a nutrition student at the University of New England, and today I will be presenting a community needs assessment for the Black Belt region of Alabama. So we're going to start off with an introduction, and then I'll move into the population of interest and the problem and importance of this community assessment, the analysis of data that I've collected, and then some solutions to the problems that are within the community. So first I wanted to start with what is a community needs assessment. It is an essential component to helping a community. It provides community leaders and decision makers with an insight to nutritional inadequacies or health issues of a community while determining what organizations or groups are currently in place to address these issues. The assessment then identifies areas that are in need of the improvement in order to help the community, and with this information, community leaders, government officials, and more could design and modify a plan for health improvement by coming up with strategies that make positive and sustainable changes within the community. So some components to conducting a community needs assessment are planning the assessment, conducting the assessment, reviewing the data that is collected, and then developing a community action plan. So the first step is planning a community needs assessment. You want to identify what community you want to assess for the assessment. So some examples of various sectors that you could assess are community organizations, communities at large, healthcare sectors. So nutritional issues are commonly found among communities of a particular racial or ethnic group or economic status, such as low income. Therefore, being that the children within the Black Belt region of Alabama meet both of these factors, we will be using them as the target population for the community needs assessment. Then we want to look at the data collection. So some common types of collection are focus groups, surveys, and key informant interviews. And for this assessment, we'll be using the key informant interview to interview professionals within the community that work with the target population. We will also be using existing sources of information such as local and regional programs, demographics, health studies, and more. Then we'll look at the potential stakeholders and decision makers. The first one we want to look at is the West Alabama Food Bank. They serve various areas within the region, and they store and distribute food within the region to resolve hunger issues among the community, and they help at least 315,000 people in need. The Child Nutrition Program. I had a key informant interview with the director of this program, and she works with the Sumter County of Alabama. So this particular program helps kids in the Sumter County, which is a county of the Black Belt region, who suffer from food insecurity. And it provides free breakfast and lunch to students. And she stated that she's collaborated with the West Alabama Food Bank to provide weekend meals to students in need. Then we'll look at this organization, A Promise to Help, which is a group of workforce volunteers, such as doctors, pediatricians, and nurses, and they help to eliminate healthcare disparities within the community. Next, we want to look at the population of interest. So, according to the 2022 poverty census, Alabama is the 6th poorest state in the United States. There are 714,000 people living below the poverty line, and of that population, 222,000 are children. So among this population, there's a vast amount of food insecurity. And what is food insecurity? It's a lack of access to enough food for an active, healthy lifestyle among all household members. and it limits the availability of nutritionally adequate food. So, a 2016 food insecurity study among African American women within the Black Belt region found that 42% of them had admitted to not feeding their children balanced meals. They also cut their children's meal portions, and they had their children skip meals. All of this led to chronic health problems and emotional issues among both mothers and children. So why is this important, you might ask? The children rely on nutritious food for growth and development. Some of these developmental aspects are brain development, physical growth, weight maintenance, emotional and cognitive stability, and more. Being that a majority of Black Belt community members who are suffering from food insecurity are single women and children, it's critical that they receive as much help as they can. So this assessment can assist children within the Black Belt community by examining the health detriments that food insecurity is causing within the community, as well as programs that are in place to help the children. The assessment will help to determine if these programs are helping the children and what changes need to be made in order to better support the children. All right, so now we have the problem statement. So there was a vast amount of obesity found among the African American children within the Black Belt community. Research has determined that nearly half of this population is overweight or obese. So, obesity among the African American children within this geographic location has stemmed from numerous factors, including food insecurity, food culture, environmental factors, and lack of nutrition education. So, food insecurity is caused by the food deserts within the region, which are areas within the region that do not have a healthy food source within 10 miles. A majority of these areas have convenience stores and fast food restaurants as their only source for food. And the children also deal with food culture problems. Their culture is filled with high fat and sugar, which promotes obesity. If their parents are feeding them common things that are found within Alabama, such as fried chicken, sweet tea, fruit cobblers, etc., the children will eat that, and they don't have the independence to make their own healthy meals. There's also environmental factors. Rural areas lack parks to play on and recreational just play areas like fields, softball fields, basketball courts, that sort of thing. So the children aren't able to get enough physical activity, and they lack nutrition education. During my key informant interview, the nutrition director stated that children received minimal nutrition education, and she wishes that there would be more, but they don't have enough time within the day to incorporate that. And parents also lack nutrition education as well. A study has found that a majority of parents within rural areas or low-income areas with children do not know anything about healthy food choices and adequate diets, that sort of thing. So, if they don't know, then their children do not know either. So they lack nutrition education as well. All right, so now we're going to analyze the data. As we can see in this chart, household expenses have rose dramatically over the past 2 years due to COVID and inflation. So a study found that 58% of mothers were worried that food would run out throughout the week before they got paid again. 45% of mothers stated that the food that they bought did not end up lasting all week, and 41% could not afford food for a balanced meal for their children. We can also see within these charts here that obesity is common among African American children in the Black Belt region. About 42% of the sample size were found to be obese. Statistics have also shown that among these children, a majority of them got their food from convenience stores, or they skipped meals and they purchased it from fast food restaurants, etc. There is a secret meals program and a child nutrition breakfast program that is provided to students. The child nutrition breakfast and lunch program is provided to students during the school day or school week, and these are free meals for students who have food insecurity. And then there's a secret meals program that the director and West Alabama Food Bank have created to provide students with healthy meals over the weekend. They'll provide raisins, granola bars, that sort of thing. However, they aren't able to provide every student that is suffering with food insecurity with these backpacks. They only have a budget for about 30 students, which is not nearly enough. There's also a Promise to Help program, which offers free medical screenings. They're a traveling program, so they travel throughout the region, and they lack health records, so they're not able to keep track of children's growth and development. There's a New Possibilities Youth Program, which is a summer and after-school program that provide nutrition education to students. They can learn how to garden and grow fruits and vegetables, and they learn about various healthy foods and healthy food choices. However, not every student is a part of these programs, and also the children within the region lack the requirement for physical activity for students, which is 30 minutes. They only get about 20 minutes per day. So some solutions to these issues would be to help the secret meals program. So the issue that was found was that food provided does not support a balanced meal for students, and they lack nutrition education that come with the program. So I would suggest that we add fruits and vegetables to the backpacks. The risks with this would be that the food would spoil, but hopefully students will eat these fruits and vegetables before they spoil. And there should be an activity program or system that you have to complete this activity before you receive your next backpack. So this could be a set of jumping jacks that the parents could sign off on, or nutrition education activities, such as what fruits and vegetables they enjoyed from the backpack, that sort of thing. Some risks with this would be that they wouldn't complete the activity. Their parents would lie and sign off on it in hopes that they would get their next backpack. But we ideally want the students to complete the activities so that they can reduce their BMI and hopefully gain a healthier diet and actual education on proper nutrition. Another suggestion I would make is to help the Promise to Help program. They have a limited time spent with each community, so I would suggest that they gain another bus, but first they need to raise awareness, so we could do that through various donations. They also lack health records for community members, so we could present an online or paper filing system so that they could keep track of residents. And they could also provide basic groceries to households with children. So some risks with this would be obstruction of privacy of the files, and people would try to cheat the system through lying by stating that they do have children when in fact they don't. And here are my references. And thank you.